Welcome to PWS United, a podcast for the Prader-Willi syndrome community, brought to you by PWSA USA. This podcast gives the latest news in research, advocacy, and family support by bringing together staff, volunteers, PWS treatment specialists, biotech and pharmaceutical representatives, caregivers, family members, and individuals with PWS. Our goal is to share education, awareness, and resources with those living with PWS and their supporters. Join us in our mission to enhance the quality of life and empower those affected by Prader-Willi syndrome.
Welcome, everyone. We're very excited to have Nurse Lynn on our podcast today, Lynn Garrick, who is our medical and research coordinator for PWSA. And we bring all of our medical questions to Lynn. And many of you know that we have our column, Ask Nurse Lynn, where people from the community can write in with their questions, non-emergency medical questions. We always want to stress that if it is an emergency, call your doctor, call 911, all those things. What do you suggest? What do people do?
Absolutely. We have a 24-hour crisis hotline, but obviously if there's a glaring medical emergency, please call 911. Don't call us and say, what should I do? Because that will be our answer. And now you've just, delayed the process. So we have a 24-hour medical and everything behavioral support line. The Ask Nurse Lynn for our non-emergent stuff. And then crisis, always call 911. Yep.
Well, Lynn, why don't you go ahead and introduce yourself?
Sure. My name is Lynn Garrick, and I am the mom of 5 beautiful children. My youngest, John, is 19 and has Prader-Willi syndrome. I've been a nurse for over 30 years now, working in a variety of settings, but the last 18 years, I manage group homes for Prader-Willi individuals, and the last 4 or 5 years, I'm the medical and research coordinator here at PWSA USA.
So I'm guessing that through your son, you got inspired to work in the PWS field. Or had you heard about it before?
No. The minute he was born, he was my only C-section, and I thought, I don't know, there's something going on here, and I'd never heard of Prader-Willi syndrome. Like many other parents, I Googled it, and after he was born, and that was a thought in someone's head that he might have Prader-Willi syndrome, and then from there on in, it's 24/7. PWS, my job, my life, everything. Like most people, it wasn't where I expected my life to go, but this is the path that it's taken, and it's been amazing so far. So, yeah.
Well, thank you. Thank you for sharing that. So we'll go ahead and get into our first topic, our first submission today. These are submissions that have already been put out, but they're ones that we get kind of repeat topics. Mm-hmm. So we thought these would be good to discuss. So the first one is on growth hormone, and this was submitted by the parents of a 5-week-old male with deletion subtype. All right, so this person wrote in, they said, our baby was diagnosed with Prader-Willi syndrome at 3 weeks old. He is 5 weeks old in the NICU. My family has been reading about how important growth hormone treatment is. We would like to get our baby started on it, but not sure if he is too little. Should we be starting that now? How do we even do that?
Right. So a lot of times you don't want to even start in the NICU because they might give you a supply, but you have to hook up with a specialty pharmacy and an endocrinologist that will continue prescribing. And remember that with prescribing, there's a lot of things that go into that. There's a lot of lab draws. There's a lot of other factors that go into prescribing this. So a lot of times it's after that first endocrinology visit that you have that you will start to get shipments of growth hormone from a specialty pharmacy. If you start in the NICU, you might not get that steady, I'm starting that dose, and there might be a delay, is what I'm trying to say. So typically people start after they go home and are connected with an endocrinologist. So we do know that growth hormone, up until very recently, was the only approved treatment for Prader-Willi syndrome. And we know that it helps not only to promote the linear height of our folks, improve their body composition, their muscle tone, cognition, metabolic things too, that all supports that. So growth hormone is just a key. It's a standard of care to have folks on growth hormone these days. And there's no really one size fits all kind of dosing. There are some standardized formulas that the endocrinologist uses, but there's also a lot of different labs and family history that needs to be taken into account before prescribing the right dose for growth hormone.
I just learned because I was trying to get Freya's growth hormone increased, but she just started the estradiol patch. And so we're waiting because I guess the estrogen can potentially help her body
Yeah.
assimilate the
So
growth hormone better.
part of the prescribing lab, when we're looking at lab values and the big picture of growth hormone, they're drawing labs called IGF and IGF-BP3, and that stands for insulin like growth factor 1. That's the IGF-1, and the IGF-BP3 is the insulin like growth factor binding protein. So when you're talking about starting other hormones like estrogen, or if you're looking at someone that has hypothyroidism, these hormonal imbalances, or now that you're going to be supplementing with estrogen, they can alter the IGF-1 levels and the IGF-BP3 levels. So think about all of these things being hormone driven, and that's why there's so many labs that go into prescribing growth hormone and looking at things to make sure everything's in balance and we're getting the right dosage.
That makes sense. So there's a lot we could talk about with growth hormone, but we kind
Big
of
time.
just, with this one, we kind of wanted to stick with the legs, getting it started.
Yep. Getting started, yeah. And there really is no one size fits all. I think I mentioned that most endos, they have a formula, a standard formula for infants, and that most endocrinologists really treat every child as an individual, right? They look at growth velocity, their height curve compared to the rest of the family, their body composition. So it's bigger than just two lab values that they're looking at. But yeah, treatment should ideally begin 1 year or less.
When your son was born, was this protocol then? It wasn't then, was it?
No, it was because it was, and I mean, that was part of my Google search, whatever came up was, he needs to be on growth hormone. And luckily, where I'm from in Minnesota, we had a Prader-Willi clinic, and with a doctor that had, done this for 20 some years. So he was comfortable in starting John, but we had to stop him because he ended up in the NICU on a ventilator from RSV as a baby. So he kind of went on and off for a while, but he started at a couple months old. Yeah.
Yeah. I mean, Freya's 13, and it was a pain in the butt to get her on it. It was months. It was
I
so
feel, yeah, so many families throughout the world and definitely the United States experience varying levels of frustration
yeah.
getting the prescription, in hand to start, and then getting it consistently. There've been shortages. There's all these other factors that go into it, insurance changes, and then you're having to fight with insurance and all of that stuff. So unfortunately it's not something that you can just run to the drugstore and buy over the counter.
I think too, Lynn, we've definitely gotten some people reaching out. Even in the past year, I can think of two times this happened, but that they were told maybe they don't need to get their child on growth hormone by a medical professional. And we're like, no, it's really important. And we put out our growth hormone volume 3 booklet to the world to make sure they
We
know and they can
should.
share it with their medical, people. But does that happen?
Oh, absolutely. It still happens. As parents, we never stop advocating for our children, and that really begins from the moment they're born. And it's a rare disease, right? It's a one in, 15, 30,000 people have this. So not every doctor is well versed in the intricacies and everything that goes along with Prader-Willi syndrome. They may touch on that 5, 10 minutes or whatever in med school, but they're not going to know that that's the standard of care. So when you go to see your endocrinologist for the first time, you can certainly download that or show the medical alert booklet or the growth hormone booklet. We're hoping to get that as a peer reviewed published article too, so you can just print it off and bring it to the doctor.
Mm.
But if your endocrinologist has questions, give us a call. Have your endocrinologist call us. We'd be happy to speak with them or have what we call a peer to peer consult done, which means that endocrinologist can speak to one of our endocrinologists that do consultations for us that are well versed in Prader-Willi syndrome and would be more than happy to do some education and provide some guidance on prescribing and the importance of it.
Yeah, that would be great to have and to bring. And we do have a downloadable versions of both the medical alerts booklet and the growth hormone booklet. And we can link those in the show notes. And they're on our homepage of our website as well. Easy to find.
Yeah, we have a lot of great information on the website. I usually send out for my Ask Nurse Lynn columns. I also like to attach peer reviewed articles too. And for some medical professionals, they really like those peer-reviewed articles to, okay, now that means a little bit more sometimes to some providers. And so I try to link helpful resources too when people are writing in.
That's amazing. Smart. As you are, Nurse Lynn. Next subject we wanted to touch on again because we get a high amount of people asking questions along this topic line is skin picking. So this question was submitted for a female, 42 years old with a deletion subtype. And it says, my daughter is a severe picker, and I'm wondering if you have any advice that would help. Just as
Wow.
simple as that.
Yeah. So we have several things on our website, booklets, pamphlets, a lot of stuff on the website to download. But skin picking with Prader-Willi syndrome is very common. And what we think about skin picking is that it is definitely part of a sensory disorder, right? So they're needing to have some sort of sensory input, and it is very common. But it is also very troublesome because some people are pulling their hair. They have just band-aids everywhere, and then they get infections, and some people might need to be hospitalized for some of those infections. So it is really a kind of a combination of approaches, environmental things, right? And behavioral strategies. So you obviously want to make sure that they're keeping their nails as trimmed, right? Sometimes for some of the ladies and even some of our male folks, they like to go get their nails done. That gel polish or whatever, it's so thick that it kind of decreases the actual good picking that they can get in. Things like fidgets, gloves sometimes, at night, because some people just even they pick when they're asleep. A sensory diet too, meaning there's a structured times throughout the day, whether they're picking or not, that you're doing engaging in some type of sensory activity, whether that be brushing. They have like autism brushes and you're brushing their skin. Some people really like deep pressure. It can be just let's go work on a puzzle, kind of distract them from doing things. And some people do see skin picking more often in times anxiety or stress. They're worried about something, and then you might see an increase in skin picking.
You used the phrase sensory diet, which I've never heard of, but basically that's
Oh,
like a schedule of like sensory.
it is different sensory activities throughout the day. So these can either you can informally do something throughout the day at different times, or you can have an occupational therapy assessment done and they will give you like a printed off thing. Here's what to do at times of the day. And you want to do that all throughout the day at different times, not just when they're picking. Oh, let me squish you or whatever. You just want to do it throughout the day to get that good sensory input. It can be a soothing bath. It can be, aromatherapy. It can be deep pressure, fidgets, all of those things. So we talked about keeping them busy and distracted, checking for underlying medical issues. Do we just have dry skin? For me, I live in Minnesota. It's winter. My skin is dry, right? So I need to put lotion on, make sure if they do have open wounds to treat them appropriately. Some people use liquid bandage, some people use actual band-aids. Make sure that you don't have like adhesive sensitivities either, because you can get like tape burns almost on your skin. Some people do find some supplements to be useful. N-acetylcysteine or NAC, that's an antioxidant, and that was tested. There's some other medications met with varying degrees of efficacy in our folks. And so that's something to talk to your provider about too. Sometimes just working with some cognitive behavioral therapy also can be effective, and that really just kind of tries to rewire the brain a little bit. But a lot of time that good sensory stuff and just really being more present and active and hands-on with our folks. So yeah, that's about it for that. The same goes for rectal picking. Make sure you're looking at constipation and stuff like that too.
Right, that could have an even deeper underlying issue beyond
Yeah.
just the skin.
Oh, absolutely. Yeah, the constipation. And for the skin picking, for in Minnesota where I'm at, mosquito season is bad because when they bite you or when, you're just itching that all the time. So that's when we really see a lot of our folks. So hospital with infections.
Yeah, Freya has had kind of phases in her life where it's been more common. And I remember the last one, I think, was when she was starting. It was one of the years she was starting school. Maybe it was when she was starting sixth grade. And I was giving her the acetylcysteine I got from our local co-op. And yeah, it really seemed to help. And now it doesn't happen too much, but sometimes, if we're sitting there watching a movie and she doesn't have anything to do with her hand, she does like this hand wringing, and then she'll say, "Will you massage my hand?" Like that helps her. Like she's learned to ask me to kind of massage her hand if she's feeling extra tactile, I guess.
Mm.
Yeah, and that's good, and that's good that she somehow can recognize that with herself.
Mhm.
I need this. I need you to do this to me, and that helps center her and takes her mind off of that. So that's amazing. But is that something that you intentionally, kind of taught her? Like, oh, it looks like you're wringing your hands. It looks like you might need, can I help you? Can I rub your hands or put lotion on you?
Yeah, I don't know how much consciousness was behind it on my part, but yeah, just noticing that she was doing stuff and just saying, "Here, let me have your hand," and then
Yeah.
just kind of starting it that way. Maybe more out of sometimes out of frustration, just being like, "Stop doing that," and let me just rub your fingers.
Oh, yep,
So,
exactly. I think that's probably the same for a lot of us, but it can be really disturbing and quite socially isolating too, especially for some of our folks that are on their face,
mm,
where it's very, really draws the attention right to that face that they're picking in huge areas. For some people, that's limiting for activities like swimming or community events where it's not safe to be like oozing and bleeding
right.
in public areas because they might not have the awareness either to wash their hands or keep it covered.
Mhm.
So, the more prevention and the more awareness we can become and suggest those things like hey, why don't I rub your hands? Hopefully, we get to the point where they ask, like your daughter does.
Yeah.
But it's definitely an ongoing, there's no one magic pill that takes that away.
Right. And just because they're not doing it in one phase of their life doesn't mean it won't come up again.
Yep.
So
Mhm. Yeah.
I've seen it, like I was saying, like I've seen it in times of stress and I've seen it where it's just like she get like if she's in like a picking moment, like just kind of like her eyes kind of glaze over a little bit and it's like trying to snap her out of it makes her angry and like it's frustrating.
It's really interesting that you say that. So I feel like there's almost different types of it, right? One out of boredom, one out of anxiety, one because of the need for sensory. And what I've noticed in some people, like you say, it's like invasion of the body snatchers almost. I am just the shell of me. I am picking. And I don't even see you because everything is like shut off. I don't see you. I don't hear you. I can't smell you. Like my senses are gone. I'm just in my zone picking. And to like snap them out of it is really it's difficult because 'cause they're just not even processing, they're just so in the zone of whether it's a self-soothing or self-stimming type thing. Yeah, it's interesting.
The last quick thing I'd love to say on this topic is that April is Occupational Therapy Month. And I think this topic really goes along with that and the awareness of the importance of occupational therapy. And I see this on our little note sheet here that there's maybe a sample daily sensory routine and
There
some
is.
ideas.
Yep.
And I would love to have an occupational therapist put some thoughts together on a piece of paper and we can put that into a document for our families around
Yeah.
this kind of topic and, that anxiety aspect of just trying to help and find other ways to.
Think that that's such a great idea. My sample is just very simple, but theirs would be so much more involved and from an
Mhm.
OT more knowledgeable standpoint. But again, how important occupational therapy is in the lives of our individuals, young and old, and getting those assessments done. Old school nurse Lynn thinks OT means I'm going to teach you how to make toast, right? It's not just these things. It is so much, and they're so valuable as part of your care team. And it's just all manner of things. But the skin picking, they can definitely help with and developing that sensory diet.
My
Yeah.
sister just got certified officially as an OT, and I'm going to ask her.
Neat.
Maybe this is a tangential side note, but very valuable for Freya's life. The person that got assigned to her for OT was also into the oh god, I can't think of the name, but it was like this integration of reflexes.
Hmm.
You know what I'm talking about? What's it
You
called? There's
do.
a
Yep.
name for it.
Yeah. And then they have them do that spider web thing. Like they're all like in rubber bands and stuff too. Like
Oh, we never did
facial
that, but
awareness, of their bodies and stuff because we know that that's lacking from the time that they're conceived. Yeah.
mhm. Right. Yeah, this one was like it started with and I'm gonna come up with the name. I'll have a link in the show notes to this website, Move, Play, Thrive. Sonia's story is the woman's name, but it's these rhythmic movements that we did every night. But then there was also these like hand things, but they're all working on these reflexes that our kids don't develop necessarily because of how they're born, because of that, because they're not moving their body and they're not as aware of their space. And so they're not developing these reflexes, or they don't lose reflexes they're supposed to use. And so that just hinders all of these movements, whether it's the tiny movements or the big movements. And so I always thought that was so fascinating, that stuff.
I think the more you know about the Prader-Willi syndrome and the more you know you don't know, if that makes sense. Like, wow,
Yeah.
I never thought about that. That makes sense. Like they're at a sensory deficit from the very first time that their cells are dividing, they're not
Mhm.
moving in utero. They're not getting that feedback and they don't understand how to move. And so we have to replicate that from a very early age and continue that with all these therapies.
That's gonna bug the crap out of me that I don't know that name.
Proprioception?
That's too big of a word for me. Know what that means. All right, and so our third topic for this episode is GLP-1s. We get a lot of those questions. And so I'm interested in this because I had never heard about these until I started doing the Ask Nurse Lynn. But so this submission is about a female, 32 years old with a deletion subtype. And the question is there any promise in trying Wegovy for weight loss? If so, what would be the side effects we would need to look out for?
So I think we need to backtrack. GLP-1 stands for glucagon like peptides 1. And these are naturally occurring hormones, again, in our body. And this regulates blood sugar levels and our appetites. So in us, to varying degrees, this works. Everyone and their mother now is on a GLP-1, right? All the celebrities, everyone's losing weight. Yay. And you would think, well, great, let's do this in our folks. However, here's the thing. Number one, these were first kind of developed, I think, to help diabetics regulate their blood sugars. So, in people with Prader-Willi syndrome that have diabetes, this still is a great way to kind of regulate for some blood sugar levels to keep them stable so you don't have those high, low, high, low, high, low spikes of insulin, which isn't good for anyone. I think that what we have limited studies, very few, that have shown that like it's good for blood sugar control, but doesn't give the folks with Prader-Willi syndrome the same level of sustained weight loss like it would you or I, someone without Prader-Willi syndrome. And one of the main mechanisms of actions of these GLP-1 medications is to delay gastric emptying or the emptying of the contents of the stomach into the intestinal system for further digestion. If you think about it, wow, if my stomach is full, then hopefully I'm not wanting to eat more. However, what we have to be very careful about is that we know that in Prader-Willi syndrome, to a certain degree, many of our individuals have delayed gastric or stomach emptying to begin with. And that's where we run into those problems of chronic constipation and developing small bowel obstructions and all of these other things, right? And so if we're giving them a medication that we know already does that, we're compounding that issue. And if you have someone that doesn't have good overall food control, food security. So maybe they're getting into a lot of food. That stomach's just gonna fill up, fill up, fill up, fill up, fill up, fill up. And then we could increase the risk of gastric rupture. That's kind of the worst case scenario is that your stomach ruptures or your intestines rupture because they're just so full, worsening constipation, small bowel obstructions that may or may not resolve with surgery. Sometimes you can just not eat, and that's where you need that nasogastric tube, in the medical alert booklets, right? If you study that GI algorithm, but sometimes you need surgery. So those are the dangers. So we're certainly wanting more studies in GLP-1s, and I know there's one I believe that is enrolling now in Colorado. We can get you that information if you would like to be a part of that. But we're looking to get more information on how those work for weight loss and appetite control with individuals with Prader-Willi syndrome. knowing that there are dangers too. So when parents call me, I give them this information. I give them some peer-reviewed literature. There's a statement that was put out by members of the Clinical and Scientific Advisory Board from our international community about the GLP-1 medications. But just know that, like with any medication, do your homework before you put your child on it. Before you go to the med spa or, buy it from online somewhere, it can be, there's potential dangers. So, yeah.
Well, it sounds like really the only benefit would come from the regulating of the blood sugar, but there's probably other things that do that.
There are, and I think that for some people, they do have difficulty regulating that blood sugar, whether it's the oral agents that just don't work. So then they're moving to the insulin. Maybe that doesn't work. And then they want to augment that with one of these medications. Yeah, there's a lot of ways to control blood sugars and diabetes. So talk to your endocrinologist about that. But a lot of endocrinologists, again, don't understand the delayed gastric emptying component for individuals with Prader-Willi syndrome. So that's where if you come in and you hand them some of this literature that we have or have available for you, then they can go, okay, perhaps we can try something else.
Well, it almost seems like you'd want a gastro doctor, gastroenterologist for this medication, no?
Well, I think probably not because, you could, but I think it's going to go along with your endocrinologist because they're the
Because
ones
it's hormonal.
in hormone and insulin type stuff. Yeah, you definitely don't want to go to your local med spa or the online things because you just don't know how to dose it either,
Right. So don't click on that Instagram ad.
No,
Get it from there.
don't. Please don't. No, please don't give your child stuff like that.
Never.
Without
Never.
going through a physician. Yeah, yeah. Oh my gosh. There is hope on the horizon. We have our first approved ever treatment for hyperphagia and several more in the pipeline. So that is hopeful. More to come on those medications. I think that we're in a good spot right now in our community.
All right. Well, Nurse Lynn.
Affectionately now known as Nurse Lynn.
I know. I think that's so funny. People everywhere go, hello, it's Nurse Lynn. I'm no longer Nurse Lynn.
You're like the wizard.
I am
Yeah.
I hope to be someday like the wizard. Very, very smart.
All right. Well, I really appreciate you coming on and talking this over with us. I appreciate all the work that you're doing with Ask Nurse Lynn. It's just incredible. And you've really done a lot to help families get more information and be more educated and make
I hope so. And thank you for thinking about it, you guys. This column and okay, let's do it. So I do hope
It
that
was
it
one
is
of those, yes.
informational and it's actually quite a bit of fun to come up with some of the responses and to see what the questions are. And yeah, I do hope it's helpful to the community.
And we
All
do
right.
have all of our past Ask Nurse Lynn responses on our website. If you just type in Ask Nurse Lynn in our search bar on our website, they'll all populate and come up and you can find the 90-some answers.
And I'll put that link in the show notes. And then you can also, I'll put a link to submit your own non-emergency question. So
Perfect. Thank you.
Thank you for listening to this episode of PWS United. If you want to learn more about Prader-Willi syndrome and how PWSA USA is making strides in advocacy, family support, and research, visit www.pwsausa.org. And while you're there, we encourage you to sign up for our Pulse email newsletter to stay informed about the latest news, resources, and events. Don't forget to subscribe to the PWS United podcast so you never miss an episode. Our team is always available to support families and their loved ones living with PWS 24 hours a day, 365 days a year. You can call us at 941-312-0400 or email info@pwsausa.org. Catch a new episode next Tuesday, and until then, have a great week.